Conversations on Energy FM 102.1 and Choice FM 101.1. It's that time of consulting with our resident gynecologist, Dr. Maluleke, and that means for the next an hour or so, we are taking all of your gynecology related questions. This is how you can get in touch with us, so you can start sending all of your gynecology related questions. Our WhatsApp text line is 079-295-1212, 079-295-1212, or send us a voice note to 0607715107, 0607715107. There's also the option of giving us a call.
Have your say. Call us now on 015-151-1058.
015-151-1058. That is the number to dial should you wish to ask your question to us in that particular regard. Doctor, good evening. Welcome back.
Evening, Rebecca, and welcome to our listeners.
How are you, Doctor?
I'm well, and you?
I'm well, thank you. We'll immediately get into the questions so that we're able to exhaust as much as we can. We've been having a lot of people complaining to say it seems the time is not sufficient and it's an hour. I'm not too certain what more we can do away from that. So we're going to immediately get into the questions that have already started coming in so that we're able to exhaust as much as we can. Are you cool with that?
Yeah, sure.
Okay. Good evening, Rebecca and Doctor. I would like to ask, is it healthy or are there any benefits of not wearing underwear as a woman during the day or at night?
Actually, it is quite healthy not to put on underwear because there is sufficient ventilation in the vulval area. And this is one of the things people can do if they want to avoid getting recurrent thrush. Because we had said that thrush seems to survive and thrive in a dark, warm and moist area. So people who don't put on underwear, you will find that you create an environment where thrush is not likely to thrive. So it's actually a healthy thing to do.
All right. Let's take a few more. Good evening, Rebecca and Doctor. Is it normal to have yellow discharge after unprotected sex with your partner?
Yellow discharge is not normal. A normal discharge is whitish, is not itchy, and has no bad smell. Once it changes color, it's got a bad smell or it itches. It suggests that there is an infection. So that's not normal.
Perhaps let's take it from there to say changes that will most likely come about immediately after intercourse in terms of a female with regards to vagina and issues such as discharges that will come about. What is normal immediately after intercourse and what isn't?
Well, because there is semen in the following intercourse, especially if you have used no protection, semen would be also a whitish, clear, sometimes even a bit clearer. Well, maybe sometimes, depending on what the person has eaten and how long he has taken before they had intercourse, it might come with a bit of change of color here and there. But normal semen is whitish, and any other color should suggest that there's a problem.
Hi, Doctor. How long should it take to have sex with my partner after giving birth? It was straight, not scissor. Straight. Interesting.
Normal.
choice.
It means normal delivery. In general, we assume, or not that we assume, we know that everything will have normalized within 6 weeks of birth. Okay? At 6 weeks, things have normalized. We are talking here about the healing of the genital area, because even if it's normal delivery, sometimes there are injuries that the woman would suffer. And this would need time to heal. Secondly, there are discharges. Initially, there will be blood, and the blood changes, and it becomes what we call lochia. And the lochia will go from being reddish up to a time when it becomes whitish. And just the stress of having given birth to a baby would take all of that time for things to go back to normal. So at 6 weeks, we assume that the couple should be ready to start with intercourse. And this is why when they come for their 6 weeks checkup, Among other things, we discuss contraception with them, because then we know that that is the time they can resume with sexual activity.
All right. Good evening, Dr. and Rebecca. Is it possible to do a termination of pregnancy during plus or minus 5 months?
No. We must emphatically say so. The law says termination of pregnancy can be done liberally when a woman realizes that she's pregnant and she's below 12 weeks. That's below 3 months. Beyond the 12 weeks, it can only be done under certain conditions. It's no longer at will. You can no longer just go and say, I don't want this pregnancy, and it can be terminated. There has to be certain reasons, some of which are medical, that doctors would have picked up, and they will advise you to have the pregnancy terminated. But the legal one, the one where you don't need permission, you don't need to ask anyone to go and do it, it has to be done below 12 weeks.
All right. Let's take a voice note.
Hi, I hope you're good. Doctor, I'm having a problem. 2 weeks before my date for my period, I would find a small or droplets of blood on my panty liner, and they would go about a whole full 2 weeks. So I don't know if it's normal or should I be worried. Thank you.
Doctor?
Right. I think the listener is having a particular condition which also is mediated by hormones. And from what she's saying, it happens every time. 2 weeks prior to the flow of blood, there is a bit of spotting. However, I would urge her to go and be examined to exclude organic problems on the cervix itself, to see if there are no problems. Among other things, they would do a pap smear. But if it's something that is happening cyclically every month, then we would assume that for her that is normal.
All right, this is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 060-771-5107, 060-771-5107. Good evening, Rebecca and Dr. Maluleke. Is it possible to fall pregnant if one has had unprotected intercourse few days after their period?
Well, let me say it depends on the cycle of the individual. But a few days after menstruation, in the majority of people, it would be unlikely that they can fall pregnant, because at that time, the egg has not really formed yet, or the egg is not mature, or ovulation will not have taken place. But, depending on the length of the cycle, some people have very short cycles, and in those instances, it can be possible for them to conceive. So if you don't want to fall pregnant, the wisest thing to do is always to use contraception, and not just hope that things will not happen because you are observing certain things or certain times. Just be on contraception, you'll be safe from falling pregnant, because we don't know how long your cycle is. We might be speaking for someone whose cycle is 28 days and maybe yours is only 21 days. Those with 21-day cycle, they can conceive a lot earlier than the ones with a 28-day cycle.
Are we able to determine how many days exactly are these when you say they could conceive a lot earlier, doctor, for those with 21-day cycle? We
had said on numerous occasions that the first part of the cycle is the one that varies in terms of length. But the second part, which would start from ovulation to menstruation, that one is always constant. Okay? It's always constant. It's from ovulation to menstruation, it is always 14 days. All right? So if you don't know the duration of your cycle, or if you want to determine your fertility time, then you can work it backward. That if I menstruate today, it means 14 days ago was on this particular day, and therefore I'm ovulating around that time. But the first part will differ from one person to the other. So it's actually very difficult to can come up with a blanket kind of advice, because people don't have similar cycles. But speaking for those who have a 28-day cycle, and these are the majority of women, their fertility would then start between the 12th to the 16th day of that cycle. Although we know that ovulation will happen on the 14th day, sometimes it can be a day earlier, sometimes it can be a day late. And sperm, on the other hand, survives for up to 72 hours. So a woman who ovulates on the 14th day can still fall pregnant if she had intercourse from the 12th day of that cycle, because sperm will still be there in her system that can fertilize the egg that was not there at the time of intercourse. So these things are, from differing from one individual to the next.
All right. Good evening, doctor. I have a problem of not having an orgasm during sexual intercourse, but when I'm masturbating, I do orgasm. I'm 33 years old. I'm a woman. It happens with more than one man. Do I have a problem?
She has no problem. That's just the way she is. There are people who are unorgasmic. Others will only experience orgasm with a particular partner. Others would, like her, would have orgasm when they masturbate, and others will have orgasm every time they have intercourse, and even with masturbation. And there are those who are unorgasmic. They do not experience orgasm, but they can enjoy the sexual act without necessarily reaching orgasm. Sometimes they say, Rebecca, when you travel, when you take a journey, you need to enjoy the journey itself and not look forward to the destination.
Gotcha.
Right.
All right, we are talking all things female health with our resident gynecologist, Dr. Maluleke. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. That's for your WhatsApp text messages. There's also the option of sending a voice note, and the number to send your voice notes to is 060-771-5107, 060-771-5107. And alternatively, you can give us a call. The number to dial is 015-151-1058, 015-151-1058. We continue with all of your questions after the break.
Have your say. Call us now on 015-151-1058.
Sitola Accountants is a registered bookkeeping and accounting practice established to assist schools with their audited financial statements. We pride ourselves with quality work, punctuality, and also taking pride in supporting our clients with social responsibility and donations. We are registered with the CSD and Cyber. Find us on R71 Road next to Paledi Mall or call 015-151-0078 or visit sitolaaccountants.co.za. At Sitola Accountants, we'll beat any current invoice with 10% less guaranteed.
Are you experiencing blurred vision, headaches, or painful eyes? Spectacle Hut can help you. We offer full comprehensive eye examination at affordable prices. Branches in Polokwane, Thornhill Shopping Center, and Library Gardens. Also in Thoyandoro, Makado, Malamulele, Giyani, Elam, and Musena. Take advantage of the following specials at all our branches. Buy one, get one free, 20% discount on frames, lenses for pensioners, and Wellness Wednesday packages from 950 Rand. Visit spectaclehutsa.co.za or call 015-291-2920 for appointments. Spectacle Hut Optometrists. We are more than just eyewear. Home away from home is what a tourist, traveler, and businessman will experience at the Butterfly Tree Guest House. With 11 air-conditioned super fruity rooms, a poolside, free Wi-Fi, proximity to beautiful and contrasty attractions, which include a sundown boat cruise and so much more. Butterfly Tree Guest House, your friendly and cool oasis in Palabora. We also offer a shuttle service from Polokwane. For more information, call Clifford on 079-549-7665.
The most exciting part of a wedding for a bride is wearing the perfect wedding dress. Beauty of the Bride specializes in perfect wedding dresses designed for a fairy tale wedding at affordable prices. Come check out the new Beauty of the Bride Bridal Boutique in Polokwane and find your perfect dress. Visit shop 13 Standard Bank Square, beautyofthebride.co.za, or call 072-472-5181 to book a free appointment. Beauty of the Bride. It's all about the dress.
Conversations with Rebecca Pala.
The time is 12 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. We are taking all of your gynecology-related questions. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 0607715107, 0607715107. There's also the option of giving us a call. The number to dial is 015-151-1058, 015-151-1058.
Have your say. Call us now on 015-151-1058.
We go back to the WhatsApp text messages that have come through. Good evening. What causes the cervix to drop down to vaginal opening?
Right, that is what we call genital prolapse, and it is in most instances a result of vaginal deliveries. If you have given birth to children and you gave birth to them the vaginal way, that is one of the things that can happen. So childbirth is one such factor, but there are a number of other things that can lead to this happening. Anything that increases the intra-abdominal pressure is likely to lead to the genitals or the uterus prolapsing. What are these conditions? Chronic cough, obesity, chronic constipation, and also if you tend to pick up weights, if you are picking up things all the time, this will increase the intra-abdominal pressure, and they may lead to a prolapse. The other factor, the other issue that seems to be a factor, is the menopause. When you reach menopause, the integrity of the pelvic floor structures is affected somewhat because of the lack of estrogen, and there is weakening of the tissues, and therefore a combination of menopause, childbirth, obesity, and all these other things will easily lead to a woman developing the prolapsing of that cervix and the uterus as a result.
All right. Let's move on to other text questions. Good evening, doctor. Was preventing for 2 months now. I have experienced pains before the injection as well as after, so I stopped preventing. Now I want to see my periods. What can I do to see my periods? I think we've dealt with a question similar to this one, but let's just reiterate.
Right. If you've been on the injection and you, after stopping you do not menstruate, there are a few things. What you've got two choices. The one choice is to do nothing, right, and wait for your body to eliminate the injection from your system. When that happens, the period will come. However, when it does, it's not going to be a normal period. You're going to find that you bleed for quite some time before the cycle normalizes. That's the one thing you can do. The other thing would be to immediately go on to the oral contraceptive. Because with oral conception, remember that the injection contains progesterone only. All right? There is no estrogen. So when we give the pill to you, we're giving you a combination of estrogen and progesterone. And necessarily when you do that, you're going to have a withdrawal bleed right at the end of that package that you are using. So for those who would like to resume menstruating, it would be easier to start taking the pill for at least 3 months. And after 3 months, you stop. And in the majority of people, the cycle will have normalized and does not need to be assisted.
Good evening, Dr. and Rebecca. Just for interest's sake, why is it hard of late for women to fall pregnant as compared to the olden days? Is it hard now, doctor?
No, it's not.
Where is that coming from? Do you know?
It is not hard. It's not hard. Problems have always been there. And many people, even in the olden days, struggle to fall pregnant. but it's not hard at all.
So the difference could just
Maybe
be
it's just that nowadays people are much more aware
that, and
they talk about these things and they are written about. But in the olden days, people would keep quiet and not talk about these things. Yes.
All right. Good evening, Rebecca and Doctor. I'm asking for my wife. She always has sores, I'm imagining, in her private part. I took her to the doctor and they prescribed antibiotics, but then they don't go for long. And the other thing is that at night she shivers and then she sweats. But the doctor said it might be the operation she had while having a baby. How true is that? I think let's start with the first question.
Right. The source, it would be interesting to know what they were told. The fact that they were given antibiotics suggests to me that this is an infection. But what kind of infection? You've got a number of possible causes there. The commonest source we see in the genital area are due to shaving, what we call folliculitis or carbuncles. When people shave, they tend to have ingrowing of hairs and they tend to form those things, those kind of sores. So if she's shaving, that could be one of the possible explanations. Then, of course, the infections would be the next group of causes. We've got bacterial infections, we've got viral infections. With bacteria, there could be granuloma inguinale, there could be syphilis, and a number of other possible infections. Then you've got viral infections. Commonly, we are talking about herpes virus, herpes simplex virus. The typical sore of herpes simplex would be a blister-like sore which contains water, which is painful, and when you puncture it, the fluid that drops on any other area may lead to a sore or a similar sore developing. This is sexually transmitted, and unfortunately, when you get herpes, you get it for life. And there is actually no treatment for herpes. In other words, there is no medication that can cure the herpes. The medication you take is to treat the symptoms. So the fact that it is recurring makes me think that this is possibly what the listener is or the wife is suffering from. And herpes, being a viral infection, shall not respond to antibiotic treatment because antibiotics will treat bacteria and not viruses.
Okay. The second question, they say she shivers at night, but she also sweats, and the doctor says it might have something to do with an operation when she was giving birth.
Very unlikely. Night sweats, shivering, we immediately think about two conditions. One, TB, and two, HIV. Those would be the things that they need to go and exclude. And an operation does not do that unless the operation is still fresh and is itself infected. So if you have post-operative infection, it can do that. But an operation that is long healed will not be a reason for this kind of situation.
All right. So if it was to be that she recently gave birth, it could be because of the operation.
Then yes, there could be an infection which requires antibiotics.
Okay.
Yeah.
Good evening, Dr. and Rebecca. I've been dating my boyfriend for over a year now and everything has been great. But recently, every time we have intercourse, my vagina becomes very, very dry. What can I do?
Right. Dryness during intercourse, there are a few reasons why this may happen. The first one would be insufficient foreplay. When people are in a hurry to have intercourse, a woman needs to lubricate enough, and she's able to do that with sufficient foreplay. Two, if sex takes too long, okay, if it goes on and on and on, ultimately there will be dryness, and that will lead to the situation we are seeing here. And of course, relationship issues sometimes, fights, or stress, that can lead to this kind of thing happening. So they need to go and look at what could be the possible reason. It's not a medical problem as such. It's got to do with what is going on during the sexual act.
Okay. Let's take a voice note, doctor.
Gynecologist, I was trying to have a baby, then doctor put me on the climate CLOME tablets. Then doctor said I must take it after 3 days of menstruation. Then I did take it. It was good effect. There was no problem after taking the medication, but I was experiencing abdominal cramps after 5 days. After 5 days, then it comes and goes. Then after that, then I experience on my right abdominal stomach, I experienced a sharp pain. When I stand up, then it was very, very much painful. And when I walk, it was very much painful. It comes and goes. And when I lie down and I cough, the pain it was still there, but it was just only for 1 day. Then after 2 days, I experienced hot flashes. During the night, I can wake up not, and the whole bed was not, and I have to wipe myself, then I can go back to sleep. It went and on for a week. Then my menstruation come back. It was spotting. It comes with a spotting, like when I wipe it, it was pinkish. Then the next 2 days, it was a dry black brown discharge. Then I didn't know what kind of menstruation is that, but I thought maybe it was only spotting then, or maybe menstruation. Then I took pregnancy test, it came negative. But now, doctor, I have a month now after using that Clomid medication. I experienced some little bit cramps because I don't have money to go back to the doctor so that he can tell me what to do next. That is why I ask you, is it the medication was in a good effect? All the signs that I was having, is there any problem in my body, or I need to advise the doctor? What must I do? The next step, I really want to fall pregnant. Must I take that Clomex again so that maybe it can help me with to fall pregnant? I don't know. Any advice, doctor, please?
All right, doctor.
Yes, the listener wants to fall pregnant, and she went and was given ovulation-inducing medication. The drug she mentions there is what we give to stimulate the formation of eggs. Remember, Rebecca, that under normal circumstances, every woman would produce 1 egg, or the majority of women will produce 1 egg per cycle that is available for fertilization. When we give women this kind of tablet, we want to increase the number of eggs and therefore increase the chances of her falling pregnant, which is why some women who fall pregnant after taking this medication would actually get twins or sometimes triplets. It is an ovulation-inducing medication. The symptoms she's describing are typically what happens in women who will have taken this. You know, she talks about feeling cramps, pain on one side of the body, hot flashes, things such as those. These are some of the side effects that one can experience when they took this medication. What I normally tell women when we give them this medication is that the reaction and the results of taking the tablet would differ from one person to the other. There are those who will fall pregnant immediately after taking the medication, and there are those who would only fall pregnant after a number of attempts at trying to conceive. And the listener wants to know what is the way forward. The way forward would be to go and have a repeat of the medication. The caveat, though, is that we do not know whether she's being given a trial of this medication or she's actually a good candidate for it. I'm saying this because the assumption that we sometimes make when we give this medication is that the tubes are normal and that the man is normal too. All right? That is the assumption we make. But strictly speaking, before we give anybody this medication, we must have determined that the tubes are normal. And we must have checked the man. And then once these two are okay, then we can give a medication to work on the ovaries. Because currently they are giving her medication to stimulate ovulation. But what if the tubes are blocked? What if the man also needs to be treated? And this is partly why sometimes you find that people don't fall pregnant, is because we are taking shortcuts. We do not do a full investigation before we give the medication.
So people must just go big or go home.
Absolutely.
All right. Here's a reminder of how you can get in touch with us should you wish to ask a question that has to do with gynecology. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 0607715107, 0607715107. This is how you can give us a call.
Have your say. Call us now on 015-151-1058.
015-151-1058. Here's a voice note.
It's anonymous. Put you or doctor last week. The menstruation worker womb olgam home jokare unalamamina and all thick. So we give a doctor could that mean gabagili pregnant miscarriage or what? Because kibiki makachaga mko bikwana madial kawana. I believe that's what's on element.
Doctor?
Right. Every time there is a change in the menstruation or the cycle, the first thing we would think about is definitely pregnancy. All right. Once the cycle changes or the menstruation itself is not normal, we think pregnancy. But it could just be a once-off kind of problem where the ovary did not function well, and in the next cycle things can go back to normal. But if she is pregnant, she would already start feeling certain symptoms of pregnancy, such as nausea, such as vomiting, such as tiredness, bloatedness. All these things will be there by now. So if they are not there, then it could just be one of those things where in that cycle there was abnormal ovarian function, but things will normalize.
All right. Okay, doctor, let's take another voice note.
Blood flow is heavy, and then now she says that she has like some blood clots, and then she doesn't know what to do. So my question is, what can we do from here? Because we don't know actually what to do. Thank you.
Doctor?
Yeah. During the years when I was lecturing to medical students, we would give them a scenario like this, and we would expect them to make a spot diagnosis. We give her someone who's having period pains and they bleed and they have painful, heavy menstruation with clots. What's your diagnosis? Right? Or we ask them to give us a differential diagnosis. Differential diagnosis, we want 3 conditions in their order of likelihood that it could be the reason why there is something similar to this. If I was to give a differential diagnosis, I would start with 1, fibroids, right? Uterine fibroids would do this. 2, it could be endometriosis. It does the same, all right? Very much similar to that. And 3, it could just be an anovulation in the previous cycle, that she did not ovulate very well. In this last instance, when she's examined, they will find that the uterus is normal, the tubes are fine, the ovary is normal. Right? But in the other 2 cases, on examination, there will be certain things that are picked up to try to help us reach the diagnosis. So either way, we still need to examine her and come up with the most likely cause of her problem. Yeah.
All right. Mukhadi joins us on the line. Good evening, Mukhadi. Welcome. We are well. Mukhadi, are you well?
Yes, I'm working.
I'm with the doctor. Talk to us.
Okay. I had a C-section last year, October, which was 6 months now. So then I get a prevention injection on January. So then I don't know, the injection didn't work. I don't know what's wrong.
What do you mean it did not work?
The injection. So
What do you mean? What do you mean it did not work?
I'm
You conceived. Okay. Right.
So what I'm asking, like, am I not going to have complications to get pregnant? It's months now.
Okay.
Is it clear, doctor?
Very clear.
Well, how do you listen for your response on the radio, ne? Thanks, doctor.
Incidentally, I had a patient today where we talked about this. Even last week, I had someone, and someone actually phoned me. I'm going to see her tomorrow because she is worried that she conceived soon after giving birth by cesarean section. And people are being told. Today, the patient asked me, is it true that if I have given birth by cesarean section, I should wait for 2 years rather, before I fall pregnant again? Because if I fell pregnant earlier than 2 years, there are going to be complications. Now, let us put this clear to the listeners. I'm not too sure where this kind of advice is coming from or what informs the advice that some people talk, and they talk emphatically to say that if you fell pregnant within this period after giving birth by cesarean section, things will happen to you. An operation that is done on a human being heals completely by 90 days. Within 3 months of operation, the operation is completely healed. Right? Let us emphasize that. The operation is healed. So falling pregnant after 3 months of a cesarean section is not dangerous at all. All right? There are no complications. Let us also give an example that some people may be aware of. You see, I see a lot of our people taking years between pregnancies, and they are saying, and I'm saying to them, do you know that the concept of conception was brought to us by the white people? Do you know that? But look at their spacing, the spacing of their children. White people will have a child this year and a child next year and a child the other year, and they are done. And you may find all these children are delivered by cesarean section. And there is no problem at all. But our people will take 5 years before they fall pregnant simply because my first child was by cesarean section. That is complete. It's a completely misleading kind of thing. I'm not sure whoever is peddling this kind of thing, telling our people, they are misleading them. An operation heals, and it heals completely. Okay? Especially if you are not going to wait for labor, there are no risks at all.
Fully understood, doctor. Good evening. How long does it take for the injection to be out of your system? I was using Nuristorate for 4 months, and last month I did not get it due to lack of medication at the clinic.
That will differ from one person to the other. With Nuristorate, we are looking at anything between 9 to about 12 months. All right. With Depo-Provera, it can go up to 24 months for the body to eliminate this. So, and it does not even depend on the number of injections you have received. It is just a person's body that will deal with the situation differently, differing from one person to the other.
All right, we have a call. Doctor, do you want to guess who's on the line?
Nyama?
Yes.
Yes.
Welcome her, please. Please welcome
Hello,
her.
hello. We are fine. How are you? I have urged them to give you an award for supporting this show.
Hi, Tadero. Are you well tonight? We're well, thank you. Talk to us. What would you like to ask tonight?
Vaginal yeast infection. Yeah, it depends on what you're using. Some of the lubricants, particularly the oil-based ones, can actually disturb the vaginal environment. There are people who will use glycerin and others will use Vaseline or even body lotions. These are not encouraged. But if you use the water-based lubricants, such as the KY jelly, or even the commercially available ones, if you go to chemists, in the area where they put condoms, you will find that there are lubricants there as well. Those are the ones we would encourage that people can use. Those are not likely to lead to any problem as such. But if you do get thrush, it might not necessarily be because of the lubricant. Yeah.
Thank you, Tadeo. Okay, let's go back to the text messages that have come through. Our WhatsApp text line is 0792951212. 0792951212. Our voice note number is 0607715107. 0607715107. Doctor, my wife is pregnant and soon she'll be giving birth. So the doctors say the baby's too small. So maybe the cause of the baby to be like that?
Yeah, this is a condition that is known as intrauterine growth restriction, right? The baby is small for the period of gestation, small for gestation. There are a number of reasons why this may be so. The commonest causes would be due to the poor placentation. In other words, the placenta hasn't formed very well. And because the placenta has not formed well, there is insufficient nutrition that the baby is receiving. One of the commonest reasons for that would be hypertension. If you have got hypertension, especially chronic hypertension, in other words, hypertension that existed prior to you falling pregnant, as opposed to hypertension that develops because you are pregnant, you tend to develop a growth restriction. 2, if you are having certain infections that may interfere with the development of the placenta. 3, there are other conditions such as the antiphospholipid syndrome or the lupus anticoagulant or even the systemic lupus erythematosus. These are conditions that will lead to poor formation of the placenta. And these people also tend to have recurrent pregnancy losses as well. They struggle to maintain a pregnancy to reach term. And one of the possible complications would be what we call an abruptio, when you have this kind of situation, wherein the placenta tends to separate before the baby is born, and invariably such babies die. But occasionally, the baby may appear to be growth restricted, what we call constitutional growth restriction, which is largely a genetic thing. In other words, if the mother is small and the father is small, the baby will be small. It's part of the genetic situation that is leading to this sort of thing happening. And that one is not necessarily an illness as such. The other ones are a problem, and we would worry. And such babies are the ones that will just die, unexpectedly. Sometimes we are forced to deliver them and allow them to grow out outside the uterus, because it means the uterine environment is hostile, and because it is hostile, the baby is not happy inside there, and taking the baby out would be doing that baby a great favor.
All right, we are taking all of your gynecology related questions. This is how you can get in touch with us. Our WhatsApp text line is 0792951212. 0792951212, or you can send a voice note to 0607715107, 0607715107. You can also give us a call as we continue taking all of your questions after the break.
Have your say. Call us now on 015-151-1058.
Your attention, please.
Hello, Viv. Can you hear me?
Please stand by.
The fact that you're hearing this voice means that local radio advertising works. Use the power of Energy FM to reach thousands of potential customers in Polokwane, Seshego, Tzaneen, Leboago, Mangwe, Mukopane, and other areas within our broadcast footprint. Increase brand awareness and improve your sales with our variety of low-cost monthly packages designed for small and medium businesses. It's cheaper than you think. Our aim is to help your business to grow. Contact Energy FM Sales now on 015-151-0039. 015-151-0039 or email sage@energyfmsa.co.za. sage@energyfmsa.co.za for a quotation. This limited offer is only available to local SMMEs. T's and C's apply.
Home away from home is what a tourist, traveler, and businessman will experience at the Butterfly Tree Guest House. With 11 air-conditioned super fruity rooms, a poolside, free Wi-Fi, proximity to beautiful and contrasty attractions, which include a sundown boat cruise and so much more. Butterfly Tree Guest House, your friendly and cool oasis in Palagora. We also offer a shuttle service from Polokwane. For more information, call Clifford on 079 549 7665.
No, you're not.
Great news! Government has begun its rollout plan for the COVID-19 vaccinations. Persons over the age of 60 can register online by visiting vaccine.enroll.health.gov.za. Let's help each other to register for the vaccine and fight COVID-19. Vaccinate to save South Africa. A message from government.
Conversations, Mondays to Thursdays, 6:30 to 8:30 p.m.
The time is 19 minutes past 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. We are in the middle of our engagement with our resident gynecologist, Dr. Maluleke. And tonight we're talking all things female health. It's an open line, and that means no question is off the table. This is how you can get in touch with us if you would like to send your question for the doctor to clarify matters for you. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 0607715107, 0607715107. If you would like to give us a call, this is the number to dial: 015-151-1058, 015-151-1058.
Have your say. Call us now on 015-151-1058.
Let's go to a voice note voice note now.
Good evening, Doctor and Rebecca. I just want to know if it is possible to get a men's sperm without masturbating for examination, because some they struggle to masturbate.
Yes, sometimes it is done, wherein they put a needle in the scrotum to go and suck the sperm out. But it is a quite invasive and unpleasant procedure to do. I'm not sure what kind of a man struggles to masturbate, because masturbation really, it should be easy. Yes, we see sometimes that some people struggle to do that, and often the advice in such situations is that they go in as a couple. In places where semen analysis is done, they would go in as a couple, and they can have foreplay as a couple, the way they do it when they are home. And then instead of him ejaculating inside, he ejaculates into the container that they give. And that way semen will be collected. So the other methods are not very, very pleasant to do.
All right. Good evening, doctor. How does one make sure that their pregnancy is in good condition?
Well, firstly, you need to eat healthily, okay? And you need to, you must eat healthily, avoid certain things such as alcohol, avoid smoking, avoid stress if you can, and some degree of exercise is also encouraged. In this instance, it will also depend on the presence or absence of certain medical conditions. That, like if you have hypertension, we may not like you to be having some strenuous physical activity, because it can worsen the situation. But basically, you observe those things. You even take the pregnancy supplements, and sometimes these supplements can be taken prior to you falling pregnant. If you are planning to conceive, you can already start taking those tablets before you even conceive. It is advisable that everyone who wants to fall pregnant should actually be on folic acid, should be taking folic acid prior to them falling pregnant, because folic acid has been found to prevent what we call neural tube defects. Neural tube defects are conditions such as hydrocephalus, such as spina bifida. If you took folic acid prior to you falling pregnant, then yes, you are likely to prevent things such as those. And that way you are likely to have a healthy pregnancy. And also ensure that you attend antenatal care, which is offered at state clinics. Many doctors also do that. And of course, gynecologists, that is their specialty, to take care of pregnant women, to ensure that the pregnancy has a good outcome. Having said that, there are many people who do all of these things, but still end up with a poor outcome. But you need to do all those things, and you'll be one of those who will be likely to have a healthy pregnancy.
All right, let's take a call. Good evening. Welcome to Conversations. We are well. How are you? Yes, the doctor is here. We're listening. Talk to us.
You're not feeling hot, and the operation is not oozing anything. There's nothing coming through the operation. And the operation site itself is not swollen. Good. All right. Now that's fine.
Is it clear?
Yeah, it is clear.
All right. Listen to the radio for your response, yeah? All right.
Today is the 13th, and she had the operation 10 days ago on the 3rd. Right. Under normal circumstances, when you give birth, the womb would have been a very big organ, all right, to accommodate the baby that was growing. But this womb needs to get back to normal, what we call involution. And the process of the womb involuting to get back to normal is often accompanied by some degree of pain. Some people will even call it labor-like pains, and especially when you put the baby on the breast. When you breastfeed, you will find that you tend to experience this cramping, and that is the way in which the womb is getting back to the normal size. All right? But in this instance, there seems to be pain on one side, and I think, if I remember well, she said on the right side. It could be that maybe that is the area where the drain was put when they were trying to drain the blood that could be accumulating in there. And there could be some degree of infection on that side, because she also says there was a bit of pus that came out. But be that as it may, in the absence of swelling of the wound, and she's not feeling very hot, whatever she has can be sorted out. And maybe the best thing would be to go and consult and exclude a formation of pus in there or an abscess, which might need antibiotics to sort it out.
2 questions from this listener. Doctor, what if one is preventing and their period appear for a month? Is it normal? And also if the person is experiencing pains throughout the period?
Right. The kind of prevention that will lead to this sort of thing happening would be the injection. To bleed for the whole month, it's because you are using the injection. The pill, on the other hand, does not do that. The pill will lead to bleeding right at the end of that cycle. The pain, as a result of the conception, the pill often prevents period pain. But the injection, because of the prolonged nature of the bleeding, to some degree, it may cause people experiencing pain. So I'm just assuming here, because she has not told us what method she's using. But just looking at what we are presented with, the likelihood is that she's on the injection. And with the injection, these things are expected.
Okay. And when they're saying it comes with pains throughout, I'm imagining it's very uncomfortable.
Yes.
So you would suggest that they consider other methods?
Yeah, they need to change and use other methods.
Okay. Hadia Matlo writes to us on the WhatsApp text line, "Hi doctor, after how long is it safe to have sex after giving birth?"
We've answered that. Khadi had not listened. We said at 6 weeks, that's the time we encourage. But believe it or not, there are people who will even start earlier than the 6 weeks. They will start earlier than the 6 weeks. As soon as the woman is comfortable, some couples start having intercourse. But 6 weeks is what we would advise everybody, because at 6 weeks, that's 42 days after the birth of your baby, everything has gone back to normal. Everything. Yeah.
I'm seeing a few more questions because we've run out of time that are asking about vaginal steaming. It's one of those that keeps coming back. If you can just reiterate what you've said without us particularly reading the questions, because it just revolves around whether you advise for or against it.
I'm vehemently opposed to vaginal steaming, especially because of the claims that are made that vaginal steaming will treat infertility, vaginal steaming will deal with fibroids, vaginal steaming will deal with cysts. Those are preposterous claims. No one has actually proven that to be the case. The only advantage that seems to accrue from the use of vaginal steaming is period pains. There are women who would experience relief from the period pains, but the rest of the things we do not encourage. If you want to relieve the period pains through heat, you can use the hot water bottle. The steaming we do not encourage. Like I said last week, the spas that are encouraging this are people in business. Okay, they have to survive. They will always advocate for the use of this thing because they are in business. Just like someone who's selling cigarettes, they are in business. Okay, but if you were to tell a doctor to speak about cigarettes, they will tell you all the disadvantages of smoking. But someone who's in business, it brings food on the table, they will continue telling you good things about smoking.
All right, doctor, that is our time. Your contact details, please.
We are at 82, not 82. 82 is my previous address. 72 A's Compensati Street in Polokwane. 015-295-9407 or 295-9419.
Thank you very much, doctor. We meet again next week, God willing.
Thank you and good night.
That's all the time we had on Conversations for this week. Coming up next is Night Flight with Matuma Malaka. A big thank you goes to you for always listening and interacting with us. I am Rebecca Pala. Enjoy the rest of your evening.